If a patient has an infection, sometimes they're going to come see the TCM clinician when the antibiotic has failed. That's pretty grim if an antibiotic has failed. This is a bad sign, okay? These patients can come in with labs and medication, show it all to you. We don't use those. We have to do the diagnosis and treatment plan based on what we do. That doesn't mean that that other stuff is wrong. That's what I think. That stuff could be all correct and right. But if the patient isn't getting better, we have to do what we do and just kind of push that stuff aside for the moment and say we're going to do a new exam, a new diagnosis, and a new treatment plan. If you do this and the patient has an infection, use strong herbs, use fairly large doses, use it at frequent intervals, do acupuncture. Again, always clear heat as the first stage of the treatment. These patients will be sick from the antibiotic in the sense that they will be depleted. So you treat them, but the order is clear the toxic heat first, then treat them for the deficiency later. Side effects. So I've had patients come to me and say, I have all these side effects from my medication. And they said, I want herbs because it has no side effects. But that's not true because there are contraindications and side effects, okay? Many traditional formulas and single herbs are contraindicated for certain patients. If you give them herbs, sometimes they will have side effects and it may they may be less severe, but the really good herbal formulas have herbs to counteract side effects of the herbs that are in that same formula and to try to tone down the toxic reaction of the herbs in that formula. That's why gansal is added to so many different ones. Okay, this herb, glycyrrhiza, gumcho, it's often added to modulate the effect of the other herbs. It is sort of a detoxicant and it helps to blend the actions of the herbs so they're gentler on the body. This is a very important herb to add. And when people have these infections, gansal by itself isn't good to give, but it's good to give with other herbs in combination. So again, always do tongue and pulse. People can describe their symptoms to you. Listen to what they say. So if you're doing the normal thing, you should be able to sort out a Chinese medicine root cause within a few minutes. That does not mean using the lab tests. We don't wait days or weeks. We give treatment to the best of our ability after a brief assessment.